Okay, all right. Why don't we get started? Thank you all for joining us today. A very exciting culmination to an event that we had in March and April this year. But I'm actually going to turn it over to Michael to bring us in, and then we'll commence our discussion.
Great, thanks, Janine. Well, so first of all, welcome to the panelists who are going to be speaking today. And thank you to all of the participants, all the ICES folks who have joined us today for this discussion. I'm sure it's going to be a really interesting one and one that I'm certainly very much looking forward to. This is just another step on a journey for ICES, one that started about a year ago or so, when we basically realized, I think something we'd known, but we recognized, I guess is probably a better word, that we needed to really think carefully about how we work with race and ethnicity data at ICES, as we recognize it's an important consideration, both in terms of health and other social outcomes, but also obviously is not just a piece of data like any other. It is a key and very personal characteristic of individuals, and one that carries great weight in our society in all sorts of ways. And these are things that we recognize, and we need to figure out, how do we as a research institute work with these data responsibly, and also engage with the communities that these data represent, the individuals. These data are ultimately about people. They're people, and people who belong to a variety of communities across Ontario. And so this is part of our effort to develop ways to work responsibly with these data. We've been on this journey, I would say, even longer than that year, in the sense that we began a similar journey with First Nations, Métis, and Inuit organizations in Ontario probably over a decade ago, and have developed I think responsible and effective ways of working with Indigenous identifying data. And I think this is another step on that journey, recognizing there are both similarities and important differences when we're talking about Indigenous data versus other race and ethnicity data. So I just really want to thank the panelists. I want to thank the ICES folks who are attending today, and also just to remind everyone that this is building on the People's Panel work that has taken place already. Some 54 individuals who've been part of discussions that have led to a report that we're going to be hearing about today. And I'm just really excited to sit back and listen. So over to you, Janine.
Thank you, Michael, for bringing us in. I'm very excited as well to introduce you to 6 of our 54 panelists that joined us for the People's Panel this year. As Michael mentioned, over the past year, we've been on this journey to learn and reflect on how we use race, ethnicity, and immigration data at ICES. And the People's Panel is definitely a key influence to help us learn that it was more than just the data that we needed to think about. And we really needed to think about our role as a data steward and a research institute, and how we want to address systemic racism in the work that we do. The People's Panel was 54 members of the public, most of them representing racialized communities, that we brought in to advise us on how we use and govern these data. ICES is in an interesting role where we use these data, but we don't collect them, and the data that we have are coded in all different kinds of ways around race, ethnicity, and immigration. But in many ways, all of these data can shine lights on issues around systemic racism. And we knew very early that it was very important that we had community voices embedded in all of the things that we were doing around the use of these data. And the People's Panel fortunately joined us for that journey very early on. In March, we put out a call to action for members of the public. We got almost 90 Ontarians say that they had they wanted to participate in this work, and we met with 54 of those Ontarians in 5 sessions over 5 weeks. It was a whirlwind of a public engagement activity, and we were so grateful for everyone who came along with us, including these panelists today. Part of that work was to look at a series of principles that were created by our core working group on how we use these data. And if you've had a chance, or maybe not had a chance yet, to look at the report, The version of the principles that were reviewed and committed by the People's Panel are in the first few pages of that report. So I encourage you to take a look at the People's Panel report and their comments there. They also gave us some phenomenal recommendations on scenarios about how we use data at ICES. We brought forward, I think, a good 30-something scenarios around how we use data, everything from accountability to governance to reporting and interpretation. And the People's Panel went through each of those and gave us a series of recommendations for how we can approach those issues. And so those recommendations are creating the backbone of how we're approaching some of the scenarios that we're putting into the ICES race and ethnicity data framework. So today they'll be talking about their perspectives and those principles and their recommendations and their views on how race, ethnicity, and immigration data are used in Ontario for health research. To read the report, please take a look at the meeting invitation. We had to sneak it in there on Friday afternoon, but it's there for your viewing, and we'll be posting it and sharing it through the Scoop and on tap and on the intranet. So please take a look and read through that. And as you'll see, some really phenomenal recommendations from them there. So enough from me. I just want to turn it over to our phenomenal facilitators today. We were very grateful to have the Tamarack Institute and the Digital Justice Lab join us on this journey. And they're also going to be our moderators for today. So I'd like to introduce Lisa Atagali from the Tamarack Institute. She's a consulting director there. And Nasma Ahmed from the Digital Justice Lab, the director of the Digital Justice Lab. They will be leading us through our panelist discussion today. And just a phenomenal team that we had supporting us as we did the People's Panel over that whirlwind 5 weeks. So I hope you learned something today. I hope you reflect today. We'll have a few chats and question answers in the chat room. We're gonna have a couple polls. And of course, you'll be hearing lots from our panelists. They have so much phenomenal insight. We did a debrief on Thursday, and I'm so excited to hear what they have to say. So I'll pass it over to Lisa to lead us through the next steps. Thank you.
Thanks so much, Janine. So let me just give you a quick overview of our agenda for this session. We are in just a moment going to jump into the bulk of our time today, which is really we've set up as a panel discussion. So the core team at ICES have been collecting and taking stock of some of the questions that they've heard so far. And NASMA is going to facilitate a panel discussion with 6 members of our People's Panel. Throughout that time, we're also going to invite you to use the Q&A box. And so if you go to the bottom of your Zoom screen, you'll see Q&A. And so at any point, feel free to add a question that you have of panelists to that Q&A box. As you see questions added, you can also like other people's questions, and the ones that are most liked will kind of head to the top of the list. And we'll be sure to bring those to the panelists as well. And then, so that's the bulk of our time today. And then we'll be doing a quick wrap up at the end. As we get started, I want to invite you to reflect on what you're hoping to learn today. And so in the chat box, if you're able to share, what do you hope to learn today from this session? Add your thoughts to the chat box. What do you hope to learn today? And one more question to ground us. I see some coming in. Thanks, Beth. What works and what isn't working. Keep those coming in terms of what you hope to learn today. And I also want to ground us in a poll. So the question that we want to ask you, and we'll my colleague Isaac, who's helping us from a tech perspective today, is going to pop up a poll. Have you done research in the past year that used race, ethnicity, or immigration data? Have you done research in the past year that used race, ethnicity, or immigration data? I just want to get a sense of experience with that, use of that, thinking ahead about the importance of how we use these data in our work. We'll leave that poll open for just 5 more seconds. Have you done research in the past year that used race, ethnicity, or immigration data? 3, 2, 1. Let's close the poll and share that screen. All right, we've got 71% of people on the call have done research in the past year that used race, ethnicity, or immigration data. Wonderful, thank you. All right, without further ado, I'm going to hand over to Nasma. And if you, Nasma, can introduce our panelists and get us started.
Thank you so much. Hi, everybody. So as I've been introduced, my name is Nesma from the Digital Justice Lab, and I'm super excited to host the People's panel discussion. So we're going to do a round of introductions, and we're going to start off with a question of why was it important for you to participate in the People's panel, and why are the discussions around the use of race ethnicity data important to you? So I'm going to call on each person to answer that question in the best of their ability and say hello and introduce themselves. So Jamal, go for it.
Yeah, so hi everyone, my name is Jamal Dumika. I use they, them, and he, him pronouns. I'm a researcher at St. Michael's Hospital, Unity Health Toronto. I'll keep this short just because I've got a lot to go through. So I do research, I used to do community-based participatory research, now I do clinical research all around HIV. I've done research with African, Caribbean, and Black communities, but also, you know, gay, bisexual, men, who men, so like queer communities as a whole. And something that, I mean, it constantly comes up is we're asking for more data because it makes it hard to substantiate the claims that we know that's happening, that people are speaking on. And it makes it harder for organizations to get funds for things that they're already trying to do, for research to continue and supports to be built. So I just wanted to give space to those who want to speak on those issues, and that's what race-based data could do. Thank you.
Awesome. Can we have Miran? Go for it.
Thanks, Nasma. Hi, everyone. Good morning. My name is Marin. I live and work in Ottawa. I work at a perinatal data registry called Born Ontario. I'm a regional coordinator where my role is mostly around education and engagement around data entry, data quality, and data use. And I'm also the health equity lead here at Born Ontario. So we're similarly engaged in a community engagement table around birthing experiences. I'm also the founding director of a local nonprofit called Black Ottawa Connect. And to answer your question, it was really important for me to join the People's Panel because Black people in Canada face multiple and intersecting forms of discrimination, and I wanted to ensure that those were considered. And I've personally heard a ton of hesitation to collect race data within the healthcare system, but the complete opposite in the community. You know, I think prior to maybe 2020, I've heard that this is just too hard, but I've never been a believer that we don't not do things just because they're hard to do. So that's a bit about me.
Thank you so much. Laura, go for it.
Good morning. Can you hear me?
Yes, we can hear you.
Okay. My name is Laura Pegmagabo Mackay. I am an Ojibwe elder that lives on Wasauksing First Nation just outside of Parry Sound. I wanted to be part of this ICES People's Panel just to give an insight from an Indigenous point of view and to ensure that what has happened to us over my last 61 years of living on this Turtle Island, that there doesn't happen to anybody else. We're all equal. We need to remind ourselves of that, and no one's better than the next guy. And that's why I'm here. Very important for me to represent my community and to ensure that all the data that is collected, and if it becomes part of our community, that comes to our community. And the final people that have the final say in our community is our chief and council. So that's why I'm here. And I'm also want to make sure that we get heard and everybody can be respectful for that. Thank you very much.
Thank you so much, Laura. Shauna, go for it.
Thank you. My name's Shauna Bourne, and I am actually a PhD candidate at Western University, and I'm actually doing research. So this is something I'm interested in from the perspective of doing research on my own. But I'm also a part of the Ontario government, and I can see how research information impacts on policy and programs and how we deliver those across the province. And I think particularly last year when this came up, it was really important to me knowing some of the impacts of COVID on our communities and seeing the data that was coming out. I really think that there's a huge opportunity for us to look a little bit more closely at some of the contextual factors that have an impact on outcomes for people from, I'll just say BIPOC people who have perhaps different barriers and issues that they face in their lives. And sometimes the data alone doesn't speak to all of that. And we have to think about that in the way that we collect data, the way that we do research, and the way that we apply it in policy and program services across Ontario. So this was really important to me. I thought that it would be a good opportunity to provide some input into things that do help to shape the lives of people, and I just think it's very important.
Thank you so much, Shauna, for sharing your perspective. Bilal, go for it.
Thanks, Nazma. So my name is Bilal Khan. I'm a PhD student at IHPME at U of T. So much like Jamal, I have a lot of experience in community-based research. And I think the reason that I wanted to participate in the People's Panel was primarily seeing how collecting race-based data and ethnicity-based data was it's almost like something unspoken of at a population level. There was a lot of hesitation around collecting it from a population standpoint, but at a community, people were actually willing to share those things, understanding that race was an integral part of understanding the differential outcomes and access to healthcare and health. So that's why I wanted to participate, in order to basically guide the framework in terms of collecting data in a way to contextualize findings when reporting race-based data, and to have a better impact on outcomes for people that are from BIPOC communities.
Thank you. And lastly, we have Kavita.
Hi, my name's Kavita. I'm a palliative care physician in Toronto, and I also do some health equity work and feel very strongly about the importance of the intersection of race and healthcare. I wanted to be a part of the People's Panel, though, coming to this from the perspective of a patient. So, having been through healthcare system, as we all have, and my own experiences of racism within the healthcare system. And my concern around how those stories are told. So when people collect our data, the story isn't always told of the outcome being related to the racism within the system, but often the stories are told of racialized people being non-compliant or preferring certain types of care that are not the optimal types of care or not the recommended care. And so I think the stories we tell with the data is so important, and I saw this as an important opportunity to be involved with that process. And as everyone has alluded to, how we tell the stories can really affect how resources flow, how funding flows, and all of those things. And so that's why I wanted to be involved. And this was not part of the question, but I also wanted to say that I felt so hopeful from being in this panel as to how thoughtfully this work is being done and being led at ICES, and that does make me hopeful for the stories that will be told.
Thank you so much, everyone, for providing such a beautiful introduction and why this is important to you and why you're participating in this process and why you have been participating in this process. So I have a set of questions that we'll be sharing with the panelists. As Lisa noted before, there is a Q&A section at the end, so please add your questions. You can upvote questions as well on that end. So first question that I have here is, one thing we hear from the scientific community is the desire for more data. Why is the use of race data different from other kinds of data? Jamal, do you want to take the first stance at this? First tap.
Yeah, and I hope I'm speaking loud enough to speak over all the other sounds. But yeah, so race is a social construct, as we know, that defines our lives and how we engage with people. But it also defines how systems engage with us. So race determines most factors that influence health. We already think of things like housing and, access to water, but it also includes things like intergenerational trauma, state violence, negligence, and at a large level, race has already been integral to building up our healthcare system, right? When we think of places like psychiatry, gynecology, public health. So racism and white supremacy as a whole has already used our data to build our current systems that we're already using. So now we must deconstruct the ways that data are being used towards, the benefit of racialized people. So we must understand how these factors are actually transforming health experience. If we listen to people already, and there's already decades of data and research and just stories that speak to this. So we know what's happening, and this is a fact. And so if we know it is true, then we must respond, right? Otherwise, we're continuing to uphold the hundreds of years where people who are racialized are harmed and silenced, right? So this is the one tool of many that we could use to overcome that silence and speak to what is actually happening. So we must balance that, sensitivity of understanding the harm that all of this is attached to, but we must also recognize the significance of race-based data.
Yeah, so balancing the harms and the significance, right, of race-based data. Bilal, do you want to add to that on how you think about this?
Yeah, no, I think Jamal said it very eloquently, and I can also just kind of add that, contextualizing race-based data, I think that's very important. The desire to have, race-based data collection and then reporting is important, but I think we can learn from our past. And I think a lot of Western countries can learn from their past, and understanding that when we present findings and we describe something, that will then be historically significant and attached to that group. And understanding to do it in a way that's meaningful, it's contextual to to them, and it benefits them in some way, and helps them in the future. I think a lot of findings in the past that have had race-based data tend to almost, put the group in a bad light because of the fact that they make them seem like, they're not conforming to some Western standard. So it's very important that, I think the desire for more data is there, but then understanding that data and contextualizing it is extremely important. Maybe that's why there's hesitation, but we need to do it in a way, as Jamal was saying, to benefit the community.
Thank you so much for sharing that. And, as we're thinking about communities, right, and data collection, some racialized communities are encouraging the collection of these data, right? So some are concerned about the unnecessary harm from the use of the data. What is the risk of not doing research that demonstrates inequities amongst racialized groups? Kavita, do you want to take a chance at that?
Yeah, for sure. So, so definitely, sometimes people may be feeling like they're hearing different messages of, it's so important to collect and use this data properly, or I guess I've learned it's now these data. And then at the same time, all these concerns of harm that can come from not doing it well or correctly. And people may think, I don't want to do any harm, so I'm just not going to do anything with that information. But I think it's important to recognize that not acting is harmful. So choosing to do nothing is choosing to continue to perpetuate the harm that exists. And so we really do need to be doing this, collecting these data and using them to benefit the communities. And an example of, there may be times where there's certain outcomes that people are looking at that are improving over time. For example, nutrition for children, or perinatal outcomes, maternal outcomes, and as a large population, things are trending well. So things look like they're going well for everybody. But when we break down the data into smaller groups and we look at specific racialized groups, there may be seeing no improvement. There may be a very small improvement, or things might even be worsening. And so those stories are really being hidden by not looking at the data more in depth, and the disparities between racialized and non-racialized groups, or different racial groups may be worsening over time, but we're missing it because we're not looking at the data as we should be.
And part of that collecting of the data and trying to navigate, what racialized communities that are impacted, we're constantly having to grapple with this idea of what is community, right? So what community means in relation to ownership, control, who can speak for the community in regards to governing the use of data. Laura, do you want to share your perspective on what community means in relation to data?
Hello.
Hey, Laura. Yeah, so I was curious, what does community mean to you in regards to ownership, control, and who can speak for the community in regards to governing the use of data?
For me and my situation where I live right now, I live on an island, one of the 30,000 islands in Georgian Bay. And for me, it's God's country. Here in our community, we're governed by the Wissahickon First Nation. And our chief and council are the ones that have the final say here in our community. So anything that goes on in here, it's got to be brought to the table of the chief and council for ratification, for implementation, and for anything that deals with our community. What brought me to this people's panels as well was when the COVID hit. Unfortunately, we lost one of our members in Toronto, and that never got reported to us until after the fact. And people were kind of upset with that and how that all transpired. So my concern is that we have to keep in mind of the First Nations peoples, whether it's Inuit, Cree, Mohawk, whatever, and remember that they come from their community. It's not their fault why they're living in Toronto. It's the communities really, because there's not enough housing here, and that's part of the issues that we're looking at to implant those housing, as well as the workforce, and particularly that young man. He was working for the city of Toronto in the Parks and Recreation. So kudos to him for going out and working all his life down there. But at the same time, like I said, we didn't find out till later that he had succumbed to COVID. So my concern from here on in is to make sure that those people get brought back to their community, and that information needs to be transported back to the community as well. So that's my concern.
Shauna, do you want to also share your perspective when it comes to what does community look like in regards to governing data?
Absolutely. So I think the concept of community is a complicated to a complex one, because people have so many facets of what makes them perceived to be who they are. So I think from my perspective, the thing that I want to bring up is that when we're thinking about representing communities in the way that we conduct studies or research, is to recognize that communities are complex, right? So me being here today, I don't represent everyone within the Black community. So I have my own voice. And I think a lot of times in the past, in terms of research, we think that the one voice represents the community, but communities are also complex. So a kind of a little bit of a different perspective. And it's important to recognize that when you hear my voice, I don't speak for everyone. There's so many aspects of who I am and my experiences that make me a unique person. And I think a lot of times people aren't considered to be those unique people that they are. So I would really encourage people who are conducting research, when you've spoken to one person, you haven't spoken to everyone. And it's really important to get out there and understand more broadly what the community needs, and recognize that we are not a monolith in terms of our thinking, in terms of our experiences, where we come from, what we've seen and what we've experienced, really to make it as much as possible clear in your research and in your write-up that what you're finding may not apply everywhere. This I think is a very important factor to consider, particularly when you have research that might have a small number of people of different backgrounds and experiences in your research. So that would be what I'd want to bring forward.
Thank you. You know, one of the pieces, and this is kind of a through line in the conversations that we're having right now, is not only about race-based data, but the lens of we're talking about of intersectionality, right? That there is also a reason why race-based data is different than other kinds of data, right? And why our concerns are different in relation to the broader lived experiences, right, of an individual. And when we think about intersectionality, we're thinking of the lens, right, where power comes and collides, where it intersects, right? So all the different lived experiences and parts of ourselves, right, that move through the world. And so, Moran, I'm curious, when we're thinking about intersectionality and thinking about why race data is different in these conversations, right? And the power that it has, the impact that it has. Can you expand on that of why these conversations are important and why these pieces of data is different in how we do the work?
Okay, so just to be clear, why intersectionality is important?
Yeah, so
Yeah.
we're thinking about why race data is different in the conversations, right? And how this intersects with intersectionality.
Yeah, I mean, I would love to pass this on because I think there's others who could speak more clearly about this, but I think Shauna just said it. I think there's so many different aspects that make us who we are, and we're not necessarily, we're not one-faceted people, so that is why it is so important. But certainly I know there's others who are going to kill this response.
Bilal, do you want to add to it around intersectionality?
Yeah, definitely. I think, because of intersectionality, looking at different social constructs that we identify with, race is a very huge aspect of it. And I think going back to what Kavita was saying in terms of when we look at, broad populations, we can find things. But then when we look at subgroups, we can find differences in how they may be experiencing things in comparison to the broader population. But then even within those subgroups, there's differences among individuals, you know what I mean? So it's like, even if someone, identifies with a specific racial group, that doesn't mean that that group is homogenous. So you cannot base your findings off of and say that, okay, everyone in this group is going to experience this or is they're having this issue with access or something like that. It's more so understanding that each individual in that group is different, and understanding that your findings cannot be so kind of paint one stroke, you know what I mean, in terms of describing that group. And intersectionality is extremely important to understand when contextualizing these findings, because that's when we don't make those broad stroke comments that apply to an entire group. And, some people in that group may not actually be able to relate to that. But again, I'll also defer it to another member to also talk maybe a little bit more about it.
Jamal, would you like to add some more to it too?
Yeah, well, yeah, so race, as we've kind of been building on, is a fundamental way of how we understand health systems coordinating the movements of patients. We see that every day with people missing referrals or being denied, being denied certain services or being elected for surgeries that they don't know about. And in the same way, these systems build and uphold racism, we cannot be quantified in the same way that data can be, right? You can pick apart numbers into factors, but as a person, I am me. And it's important for us to include that humanity in the way that we understand our data and interpret our data, because we cannot understand the ways that Black women are being affected in maternal health if we are just looking at women, right? As soon as you remove race out of it, what it essentially becomes is you're looking at white populations. And that's what we see. If you're looking at feminism at large, and if you don't include a way to include a colonial lens to it, right? To understand how the many different indigenous groups of Turtle Island have been treated and viewed and in our healthcare system, and the way that queerness is even a different idea. We have to disentangle that, right? Because people have different understandings of sexuality, because it's really about relationships. And so what does that mean about someone's ability to access healthcare services? And especially for now, when we talk about sexually transmitted diseases, it's important for us to have decolonized that understanding of relationships. So that's why, you know, someone's gender identity and someone's sexuality is important to understand there, right? So you know, you go on and on and on, and you see that someone's disability experience is determined by, again, like how they interact with even things like growing up under police surveillance, right? And the type of trauma that you're going to endure because of that. Well, you have to look at the different ways that gender changes someone's experience of state violence, right? And what that means for someone's disability experience. So you start to see that all of these different factors come together, and we have to understand that, again, we are not data, we are people. And that has to be central to our understanding of how we collect this.
Thank you so much. And I think it's really powerful to say that we are not data, we are people, right? And when we're talking about data sets, when we're talking about the lived experience of others. And so, you know, Shauna, based off of your experience, how do you feel we should balance the need for control and responsibility with the exploration and innovation needed to do scientific discovery?
As someone who loves evaluation and research, I think this is such an important question, because I can totally understand why, you know, why people want to dig into the data, why they want to get as much data as possible. But I think it's also important to have responsibility and accountability for everything that we do. And part of that responsibility and accountability includes thinking about the implications and ramifications of how that data is being used. And I think Jamal had mentioned before about how when we produce research and we produce findings and recommendations from that research, that stands for a very long time. And one of the things that we always say in research is we stand on the shoulders of giants, right? So we build upon what other people have done. When we're building upon what other people have done, there could be inherently biased information in there. And I think the other aspect of it as well too is we also like to think about like the gold standard of research, right? So it removes all these extraneous factors, and we think we're just doing like pure research, and we have the data and we're running the data. But everything about the process itself involves some bias. So the questions that we ask can be biased. The way that we interpret the data can be biased. The way that we come up with solutions or findings can be biased. And so when we start to acknowledge that in the way that we actually are doing our research, we can make a difference and become a lot more accountable and responsible for what we're doing. So I think that's a really important takeaway for people, is to think about none of us do unbiased research. We are all biased in some way and at some level. And so to recognize that will help us to do better in managing that in the way that we do our work.
Does anyone else want to share their perspective on how we think about exploration and innovation needed for discovery?
I mean, I can just add that, again, that science has explored us enough. We have seen people enslaved for science, kidnapped, you know, drugs tested unethically, people not informed of risks, involuntary sterilizations, physical assessments, again, always at the expense of racialized people. There has been too much freedom. And again, it just adds to the violence and the harm, and there's a reason why there isn't trust. It's not that we need to get people to trust more, it's that we need to do less harm. We need to stop doing harm. And so that paradigm shift towards the benefit of racialized people, as I said, part of that includes dismantling the power of what a PI gets to determine, what a research institute gets to determine, what an academic center does, right? And uplifting the ways that aren't built on colonialism, right? Ways of knowledge, systems of understanding. And this can mean different things depending who you're talking to, right? If you're talking to a Somali community versus a Dominican community, the way that all of our cultures, like we have our own understandings of what it means to know and build on health. And we have to integrate that into the ways that we explore and innovate, because that is the only way that it's going to be to our benefit, because it's going to be in the way that we understand it.
Absolutely. So, making sure that it's within the context, right? Context specific. And, Shauna shared around specifically the biases, right, that we have when we're going through research, when we're doing research. And so, a lot of harms can come from the interpretation and dissemination of research, right? Whether it's outside of the context, whether it's our biases, all the different facets that can, impact the research. So what do you think scientists need to be, what do you think scientists need to do to be, sorry, let me repeat my question. What do you think scientists need to be responsible for minimizing the harm? And what are some of the things that could be done to minimize harm? So Moran, do you want to answer that question?
Yeah, absolutely. One of the things I've just been thinking about as I reflect on some of the answers from the other panelists is that race and science have a long history together, and science has been misused, unfortunately, to justify racism in the past. And I think we can acknowledge now that systemic racism pervades many institutions, including academia. And at the very beginning of this panel, Jamal just so aptly said that race is a social construct, but I think that there could still be individuals who are kind of really committed to this idea of not it being, differences between humans is not a product of social, historical, political, etc. factors, but it's just really a reflection of kind of genetic differences, right? And that is we've been ingrained. So anyway, so I think in terms of what could be done to answer your question, maybe even looking at the roots of race science, as Shauna was mentioning, examining what biases you carry. If you recognize that you're in a position of privilege, maybe you can use that privilege to help advance the careers of other researchers, including folks on grants or co-authors. I'm just thinking about an article that I recently read about health equity tourism. I don't know if folks are familiar with this concept, but just generally that, in the past year or so, that lots of scholars or researchers are now entering this health equity space, but taking away from limited opportunities for funding or publication opportunities from folks who have been doing this work for a long time. I'm thinking about committing to fostering diverse teams. Yeah, so things like that could all be ways that you might want to think about that you could include in your work.
Kavita, would you like to share anything about minimizing harm? So how can people go about minimizing harm in this work?
Yes, so I think Maren made some very excellent points. In terms of minimizing harm, I think thinking about why you're doing the work is important, and clarifying that for yourself. And then if you want, so, there's lots to be said, but I recently came across from my own field in the Journal of Pain and Symptom Management. If you go into their author guide, so they have a specific area on race data that they've updated, that has some very clearly laid out things that need to happen for you to submit to the journal. And I think that, that is pretty well done. And so some things they talk about are to justify, so you justify to yourself why this is happening, defining what race is, because a lot of the research out there doesn't use race correctly. And other proxies which are not really proxies, like ethnicity or nationality or all these other things. So really kind of be clear about what you're talking about, and that for all of us probably requires ongoing education, listening to voices from within the communities that you are trying to do this work with, in addition to including in the work, hopefully. And then they suggest using a rate. So there's lots of people in academia, much smarter than me, doing a lot of this already. And so they suggest, grounding yourself in a framework, such as critical race theory, and they have some specific suggestions on how to analyze and manage your data using that framework. So so I would suggest, looking at a place like that as a starting point, but also, as I said, thinking about why this is important to you, and including, community and racialized people. Not any racialized people, but including community in the work.
Yeah, I'll add one thing if I can. Just generally, I think I don't know if I stated enough like the importance of collaboration with communities, with folks who are experienced in health equity research, if that is what you're interested in. Because I think, as Jamal said, like there's been a lot, we have been overstudied, and often there's not a lot of data collection. Or publication without benefit to those populations that have been studied.
Laura, would you like to add anything to what has been shared around what people can do to minimize harm in relation to the work, in relation to the research? Oh.
Is that me?
Yeah, it's you. You, Laura. Yeah. What can folks do to minimize harm?
I can only draw on my experience and what had happened to my mother when she was first diagnosed with cancer way back in the 70s. And cancer at that time was, there wasn't much research done on it. And my mother had been shipped to Princess Margaret Hospital in Toronto. And they gave her radiation, I believe it was, and they're only supposed to give her 50 hours. But her doctor had went on holidays, and in the interim, they mucked up her dosage. They gave her 100 hours. So literally, that just fried her innards and her inside. And my mother, being who she is, the doctor came back and he apologized profusely to her. And then he said to her, "What would you like us to do, Jane?" And she said, "Because you can sue me." And my mom said, no, I can't sue you because I want you to fix me. And she said, "And if I sue you, then you won't fix me." She said, "So all I want from you is to help me get better, help me get over this, and to ensure that it doesn't happen to anybody else." So as far as I know, and I might be corrected on this panel, but I think people only get 50 hours of radiation now. And that was a hard lesson for her to learn. That was a hard lesson for us to learn. And of course, you know, we thought racism and her being a guinea pig. And then on the other hand, she said to us, no, they treated me with the utmost kindness and respect. And after they made that mistake, she said they did everything that they could to help me. And through her, after that incident, anything that she needed from the medical profession, if we couldn't get it here within our community or within the town of Parry Sound, all she did was call Princess Margaret and they helped her. So that, having said that, has opened up my eyes to the medical profession, and it made me wonder how many other people were treated like that. And again, you know, we just had the incident with Joyce just a few months ago and how that all happened. And it's really disheartening to know that that is still going on in the medical profession. We're like Jamal says, we're all humans and we all live and we all breathe. So my concern from here on in is to be mindful and respectful, and to understand that everybody has a family that loves them unconditionally. And I believe in our hearts and in our family that as long as we had our mother, everything was okay. And unfortunately, she left us to go to the spirit world, because after a while, you know, like having gone through that, it was just the end of the road for her, and she knew. So we were able to get ready for that. And learning from that, I got to go forward. And I just want to ensure that that doesn't happen again, you know, to anybody. And to be mindful and respectful of that family, that they do have a family that loves them. Thank you.
Thank you so much, Laura, for sharing that. I really appreciate it. And as we enter into the tail end of this panel together, one of the questions that really came in, and you know, we can do popcorn style for folks who want to answer this, but you know, one of the things is that a lot of race-based data tends to, or at least the findings tend to focus on the deficits. So how can we emphasize that it can also be used to highlight positive findings? So what are folks' thoughts on that? How can we think about using the data that we do have to, possibly highlight positive experiences, positive findings across the board?
I'm happy to start the ball rolling, but just generally, we won't know if we don't collect it. That's the first thing that comes to mind. I think, as I mentioned at the top, a lot of the experiences I've heard or had are that this is too hard, we can't do this, and it's harmful not to collect it. It's also harmful. It can also be harmful to collect it. And we're not collecting this data just, or at least not my intention, just to focus on disparities. There could absolutely be benefits, other things that are working, but just generally differences. There was an article I was reading, and it was on perinatal differences, different maternal outcomes. And I think I was reading that that Black women potentially, this is might have shorter gestation periods, and so we need to pay attention to when they're showing signs of early labor. But as a medical system, we're thinking, oh yeah, no, it's too early. Do you know what I mean? So this could be something that is just something we have to pay attention to that might have positive changes, or that might change the care that we're providing. So I think bottom line, you don't know what differences are if they're hidden kind of in the bigger data.
Yeah, and it connects to what Laura was sharing around, what changes, right? When after a negative impact, right? What possibly changes in that? Shauna, I think you were really, smiling to answer the question. So do you want to answer your really last one before we pass it on to Astrid?
Sure. And I kind of chuckled a little bit at the question, because I think, much like Maren said, is that if we don't collect the data, we won't know what's positive or what's negative, right? So we need to have the data. We need to start thinking about it. And then hopefully over time, as we, implement changes that make things more equitable, more inclusive, we will start to see positive things and more equity across various groups. But I think for now, because of our history within this country and North America in general, the likelihood of seeing a lot of positive outcomes in our systems is low, and we have to accept that and expect that, and not get discouraged by that, but think about it rather, how can we do better? How can we make things better by what we now know, because we are making an effort to know things? And then I think over time we can hopefully get to a place where we're seeing more positive outcomes, or areas where we can help out so that there's more equitable outcomes.
Thank you so much, Shauna, and thank you so much to all the panelists for engaging in this conversation, for participating in the People's Panel. I'm going to do a couple of jazz fingers for y'all. Thank you so much. I'm going to pass it on to Astrid for closing reflections.
Yeah, thanks so much, Nazma. I'm really also grateful to the panelists. We have your document and the voices of the other 48 members of the People's Panel, but I have to say it's incredibly powerful, to hear from you in person. As Janine, I'll just reflect on a few things. As Janine mentioned, this is much larger than technical aspects of race and ethnicity data. I mean, this is really about ICES taking an anti-racist stance to the work that we want to do if we with these data. And I think Jamal said it really compellingly about this is in part about stopping the harm, but also spoke about the structures of racism, both in society that get reflected in the data, but also even within research institutes and the way in which we work. We heard, really compellingly about, the importance of context, engaging communities, the fact that communities are complex, people are complex, they don't represent entire communities, that we need to, I think it was Shauna said, there's no one, no one voice which is going to speak for, an entire community. And so again, to push us to really be thoughtful about the way in which we would engage communities and to get that input for the research. I took a lot of notes actually, and we don't have that much time, but you know, also many important comments about, you know, the importance of intersectionality. And, you know, for those of you on the phone who know our data, we do not have particularly deep data, but again, we need to sort of think about how we, you know, bring in all of those notions to the work we do. I've seen some comments from scientists a little bit around, you know, resources. And again, that's part of what, you know, as a core committee, we're trying to bring together, you know, like what are the resources that we as an institution need to bring to bear so that the research is done in a community informed way, you know, that again moves the needle, which is really what we're trying to do. So, you know, I'd say we are really just starting our journey. You know, we have been trying to bring educational resources to bear. We will be trying to do, you know, more of that kind of work, bring in experts. I can't remember if it was Jamal or somebody was talking about other equity experts, you know, that have to be part of the, you know, the process as well. And we will continue to do that. We are developing a bit of a framework and really welcome people from the ICES community to comment on it. It's a living document, and we'll be bringing it back to you in you know, other ways for comments. And then again, trying to figure out how we move forward, how we resource this and work. So again, my gratitude to the panel and to Nazma for moderating so well. And I'll just pass it on to Michael then just for the closing word.
Thanks, Astrid. So once again, to reiterate a thank you to Nazma and all of the panelists who spoke today. You know, your skill, your intelligence, your experience, your passion for these issues comes through. It came through in the report, but it comes through even more when we listen to you, and we really appreciate that. And I can tell you that it's matched by equal passion and commitment on the ICS side to really make important progress on these issues and to find a way of working with these data that will be responsible and ethical and actually help ultimately make for a more equitable society and healthcare system. That's certainly the ambition. And so it's a long journey, but these are all important steps along that path. So thank you very much.
All right, and with that, we close off. Thank you, ICS community, for joining us today and hearing from our amazing panelists. Thank you so much, panelists, for spending your Monday morning with us in the middle of the day to join us for research and analysis rounds, and to our moderators, Lisa, Nazma, and our tech support, Isaac. We really appreciate it. It has been a phenomenal discussion, and take care to everyone. Have a great week.